some of the ways a well-functioning community health program operates. Are you receiving this health protection in your community? Many communities are not. Is it fair for you and your family to be without contamination? Live in isolation. A neighbor stricken by an infection can suddenly be a menace to your family's health. Unsanitary handling of the milk you drink can jeopardize your life and hundreds of others. Careless disposal of garbage can bring disease and death into your home, no matter what precautions you take. It is here that the first signs of an epidemic can be spotted and countered in time. You'll find that the health department takes an interest in you from the very start. First, you are identified as an individual with your very own footprints. A report goes to the Division of Vital Statistics. Your certificate of birth is secured, and the world learns that it has a new citizen. By keeping records of all births, deaths, and important diseases, Vital Statistics keeps contamination, typhoid or undulant fever. And you feel confident that this food has been prepared and served under sanitary conditions. Well, of course, our health department protects us from dangers such as these, but does it? Many Americans live in communities whose health departments are neither properly equipped nor staffed to do an adequate job. And too many of us live in areas where there is no full-time public health service at all. You may feel that your home is safe. You've taken every precaution to keep your family well. At recreational centers, old folks can again gain the peace and joy which comes from liking and being liked. With the rapid growth in population, the dangers of disease and injury become greater. Overcrowding often results in a breakdown of health standards until conditions like these develop. It is to the interest of all in the community that housing like this be condemned and eliminated, and that new and better homes be built in well-planned communities. Contamination. To make sure they come up to standard and are not likely to become contaminated. Sometimes this means eliminating unsanitary privies which may menace the water supply. Control communicable diseases. Prepare for actual birth. What an expectant mother eats has a great effect upon the health of the infant developing within her. So a nutritionist from the health department helps the mothers plan a diet which is nourishing, well-balanced, and economical at the same time. Venereal disease, too, is being brought under control. Cases are tracked down to prevent spread of the disease, and free clinical examinations and treatment are offered in confidential surroundings. Records of those undergoing treatment are known only by the clinic staff. Can you assume that this animal is free of rabies? With communicable diseases on the decline, attention today is being turned to the increasing problem of chronic diseases. Cancer, which continues to take a tremendous toll among older people, is diagnosed in modern clinics, often sponsored by voluntary agencies. Bacterial contamination. The job of these well-child clinics is not to treat sick children, but to keep youngsters well by giving timely inoculations and regular checkups in order to reveal defects at their earliest stages. A staff of skilled technicians conducts microscopic examinations and numerous other tests in their relentless search for disease organisms. Here, a bacteriologist pipetting extract of beef heart into a blood sample will show at the end of her daily run which of the specimens show evidence of syphilis. Somehow you don't become as depressed with your problems when you understand them and can discuss them with others. A program of arts and crafts, sponsored by a local social welfare agency, serves to keep minds active. One of the most important jobs of a health department is to control communicable diseases. At this community-supported tuberculosis clinic, chest x-rays are offered all citizens. Bacterial invasion, a mental health clinic, also helps parents and schools discover what children can do best through special psychological tests. Here, a grade schooler reveals her ability to coordinate hands and eyes. Contamination. When your community is aroused to its health needs, you should take specific steps to improve the situation. You can see to it that old, unsanitary milk handling is replaced by clean, carefully inspected milk production. Old, disease-inviting sewage disposal methods replaced by sanitary methods which are best suited to your area. Disease-bearing parasites barred from access to homes by effective rat-proofing methods. Careless garbage disposal practices replaced by sanitary methods at home. And a sanitary landfill for city garbage disposal to deprive marauding rats and flies of a primary source of nourishment in existence.